It's important for us to understand what research is. Research, put simply, is the systematic collection and analysis of data to address a question. So just because you find something written in a book, that doesn't actually make it research. It doesn't even mean that it was informed by research. Just because something is said by somebody at a university or at a college also doesn't make it research. To be research, they have to have actually systematically collected and analyzed data to address a question, or to be talking about studies that did that. Now, research is designed so that multiple answers are possible. Researchers don't set up a study so that you could only find one thing. They set up a study so that there are multiple possibilities and they're finding out which one is actually correct. When we read research, we do need to read it critically, but it's not okay to pick and choose among different research studies. So it's not okay, for example, to say we agree with this research, but we don't agree with that research. All that research found what it found, and sometimes research finds things that aren't what we expected or even what we wanted to be true. But when we use research-guided practice, then we have to go with what our research is finding. It's sometimes helpful to think about this in terms of a medical analogy. So if we're talking about how we care for young children in the pediatrician's office, we expect that research is going to guide that research is going to determine which vaccinations that we give children or not, or how we respond when children have a fever, or how we respond if they test positive for strep throat. We want to have that same approach in early childhood education. We want to have an approach in which research guides the decisions we make about our most precious resources, which is our children.